Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the long-awaited Task Force on Child Protection has issued its report. There's some major and significant recommendations in that report. And then we continue our important series on health care. This week, guess what? Rising costs and what can be done about that. All of that follows these words, I think.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, listen, the Pennsylvania Task Force on Child Protection has issued a report. It's like 400 and some pages. We're not going to read that on this program. It contains some very significant recommendations that we want to talk with you about. This, of course, all in the wake of the Jerry Sandusky sexual abuse case. Joining me is a member of the Governor's Task Force, Delilah Rumburg. She heads the Pennsylvania Coalition Against Rape. Delilah, thanks for coming on the program.
Welcome.
Let me just say this. First of all, this report, I think, and you know, I've looked through it, contains some very. You hold it up. It's
400 pages.
Yeah, 400 pages. We're going to break that down and get to some of the significant areas that your task force looked at and recommendations that you have to make. First of all, let's start with the age-old problem. People just don't want to get involved. They don't want to report it. It's supposed to be a family matter. Why go there? Just breaking through that shield, if you will, is not easy, is it?
No, it's been a struggle for years, and I guess you know that one of the things that many of the advocates like myself have been saying for a long time, Pennsylvania has the lowest substantiated rate of child abuse in the country, and we know it's not because we have less child abuse here in the state that we're not that unique. So we've known we've had some problems. We know that there was some problems with the way the calls were being dropped and so on and so forth. So I think this is really timely that the task force is saying, number one, we have the mandated reporters, and we can talk about those people, but it's everybody's responsibility to protect children. And I think if nothing else, what's happened with Penn State and the Philadelphia Diocese is really raising the awareness of individuals in our community. Whether you're a mandated reporter or not, you should report.
So let's go through this. If you think there's child abuse going on, what does your report say about what you should do? And you talked about mandated report. Does that mean people who are legally obligated as opposed to, let's say, somebody who thinks, boy, that's delicate, isn't it?
It is very delicate.
Talk about the difference between mandated report and sort of somebody who may see something, or even though you're not required, or maybe we're all required under law. I don't know. That's why you're here.
Right. Well, no, that's one. We didn't go so far as make everybody a mandated reporter. Some states have tried that, but we did talk about that, and it isn't real effective, so we felt we were going to concentrate on those people. And we actually changed some of the definitions, the civil definition of child abuse, for example, or the term of identifying perpetrators.
Who would be a mandated?
All right, mandated reporters are anybody that has control or authority over a children. That's one of the things we changed. Previously, that was one of the problems. It was so narrowly defined that people weren't sure. We did a survey a couple of years ago, and police and nurses, doctors, school teachers
were not mandated?
Well, they were, but they weren't, and that's what we're finding. This is going to help clarify who is. We did expand it now. We expanded it to school librarians. We expanded it to include...
So if you're a mandated reporter, you are required, if this would be put into law, it's now a report that's going to the governor. Obviously, the legislature will take it up.
Right.
You are required under penalty of what?
Well, we actually increased the penalty. Before, it was like a summary, like a traffic violation.
Offense,
and now it will be a second-degree misdemeanor is what we're recommending. And with that does include a fine and could be jail time as well. So that's how serious the task force was about that. If you fail to report, there
okay, so
we
got that. So in addition to that, you've made some recommendations for I presume mandated reporters about training, right?
Absolutely.
Say something about that. Help us out there.
Well, again, when we did our survey and with our Protect Our Children committee, some of us were involved in a survey a couple of years ago, almost now, and we found that even the mandated reporters some of them had never been trained, and some of them hadn't had any training since they became like a nurse,
right.
you know, when they first went into practice. So we're really pushing hard that the reporting and the training have to go hand in hand.
So the training would go on, if you think something's happening, what you should do about it. Is that what you mean by reporting it?
Absolutely, is so that everybody's clear about what their role and responsibility is, and make people feel comfortable in doing that. You know, you don't have to have proof, and a child doesn't have to declare to you that they were abused. You just have to suspect that a child that you're in contact with has been abused and make that report. And if it's, nothing's going to happen if it's wrong, you know, then that's when you want child welfare to investigate it and find out that it's true. All
right, we're talking with Delilah Rumburg. She was a member of the task force that made these recommendations to the governor that the legislature obviously will be taking up in months ahead. We'll be back and continue this discussion after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're going to put a hotline number up if you think that there's abuse or you have questions about what to do. If you think this number, I think, is invaluable, so write it down. We're talking with Delilah Rumburg. She was on this governor's gubernatorial appointed task force to deal with child protection. All right, moving on to Delilah to talk about a couple other aspects about it. If there are 2 or 3 big things in this 400-page report that you think our viewers ought to know, what would you cite as them?
Well, I think the main thing is that we really worked hard to make the definition of child abuse easier for medical professionals and prosecutors. You know, there were some things like severe pain, and there was no way to define that in a child. So the reworking of the definition of child abuse is critical. The other thing, we made some changes in the definition of a perpetrator and expanded that. I think that will also help law enforcement be able to, you know, better prosecute the cases. The other thing was the mandated reporters, that we expanded the list on that, and we stressed the importance of training and having qualified people that are mandated reporters. And I think besides the child line and being able to make sure that it works effectively, is making sure that the people that are in the field, those child protective services workers, get the training that they need, and that we provide incentives to keep them working, because we really need well-trained, qualified people to be able to make those decisions when they're working with those families.
One of the things I think that that the report calls for, if I remember going through this, has to do with something called child advocacy centers. I mean, look, I do politics, as you know, so you're going to help educate me as well as our audience. I didn't even realize there were creatures like do we have them now in this state? We do, don't we?
We have about 20 some in Pennsylvania. Yeah, we have one here in
Harrisburg.
And
what do you want to do with them?
Well, there's a big move that we need more. There was actually a recommendation that every child be within 2 hours of a child advocacy center. And a child advocacy center is part of the investigation. And what it does, it brings your multidisciplinary investigative team together, and it's a way of caring for the child. So that child can go through that forensic interview and only have to do it once, because we have all the professionals.
So it's because
of the trauma, it is so much more effective, because anybody going through a trauma could be interviewed by a police officer and then a judge, and then later it doesn't seem the same. But if you get everybody in the same room being able to you know, experience
you're already getting
that.
support for that. I think the state District Attorneys Association have started. I mean, obviously it's tough in an environment that we live in right now with the state, you know, having huge fiscal problems in front of it. But is there some sense of optimism given the, look, on the theory that something good has to come out of something so horrible as what happened up, you know, in the sexual abuse case up there, the good ought to be that when, at the end of the day, we have processes and procedures in place and awareness that you know, we're never going to eliminate it, that we reduce it to its bare minimum. I mean, is that the big goal ultimately?
Absolutely, because we waded through the Child Protective Services laws and the systems that support it, and that absolutely is the goal. Better communication, better interaction, and the more awareness that we have and the communities have, and the cooperation and collaboration, I think we'll really begin to see a difference. I think this is a huge tipping point in Pennsylvania. I think we're talking about a culture change and the way that we all think about what our responsibility is to protect children, from the mandated reporters on down to people like you that live in your neighborhood and have a responsibility to protect children.
Now, one of the concerns that I read about, and it, you know, every report does have some critics or folks who say, well, you didn't go as far as you should have, and there's no, you know, that's typically the case. But it's what to do about past abuse cases. I think that has come up in some reports. The question in short is, if people who have suffered in the past are not really going to be helped by this, is that correct? And so the complaint is, what do they do if there are people who suffered in the past, there's no remedy in your report recommendations that would cover that, or is that wrong?
Well, no, that's correct. We felt that that wasn't our responsibility. There's currently, you know, at the age of 30 and 50 for civil and criminal. But I know there are many people that still support a window of opportunity. So I think that's not going to die. Just because the task force didn't recommend it, I think there are enough people that are committed to see some reform around the statute of limitations that it'll happen.
Well, thanks for coming on. I think this is an important report, and looks like the legislature is going to take it up in the new session. All right, healthcare costs, they're rising. What providers are doing to make sure that they don't rise anymore and that you still maintain the quality of healthcare. The folks from Highmark are here, and they're going to help us understand more about that following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back. Well, we continue our series on healthcare. We're now going to look at the cost and what can be done. We're going to narrow in particularly on what is going on at the Hershey Medical Center. But first of all, let me introduce Dr. Glenn Geeting. He's a medical director at the Milton Hershey Medical Center, and Dr. Andrew Bloschichak. He's the senior medical director with Highmark. All right, doctor, I guess we can go through this. But look, healthcare costs going up 2.5 times rate of inflation, I read. Still, it's driving employers, as I don't have to tell you, doctor, you're heavily involved in this. Talk a little bit about why healthcare costs are rising. Everybody asks me that. Why are they rising?
Why are they rising? There's so many answers to that question. Both utilization, unit cost. We as a society tend to look for that magic pill, no matter what it costs to treat our ailments. But because it's a multifaceted problem, we have many programs in place. And one I was hoping to focus on was our Quality Blue program. We've spoken about our Quality Blue program in the past that looks at both quality and efficiency, not just cost, but also quality. And one part of the Quality Blue program is we actually withhold payments to hospitals. So we'll withhold about 3% of a hospital's payments, and the hospitals will not be paid that until they meet certain quality and efficiency metrics.
So you're talking about that we require more people. The people are more demanding of health care than ever. They see, enter the medical, you see them firsthand, that they enter the so-called medical system much earlier. More people are requiring it. Their demands are greater, and they want higher quality. And you all have to deliver it with a whole new range of technology that's available and high expectations. Is that, did I make any mistake there?
That's a good summation. That's a good
all right.
summation.
So now, first of all, where do you see patients? Emergency room, right?
I'm an emergency physician.
Go ahead.
So I help run the ER.
So we liked you right away. I want to tell you that. You're welcome on this program anytime. Go ahead.
It's better to like me here. Sometimes the patients coming in don't always like me.
I get it. Go ahead.
But we did some great work with Highmark. We had set up an ED throughput project for our emergency department.
Okay.
And throughput incorporates ideas of flow. One of the important concepts of it is that the ER and the hospital are intimately connected. Several decades ago, the thought was sometimes communicated, what on earth are you guys doing in that ER? You're so crowded, can't you manage your patient flow? We realize that we're very connected. If the hospital's not flowing well, it backs up into the ER.
Now, what does that mean exactly when you say flow? Patient comes in, explain that. Patient comes in and you treat them, and by flow, does that mean they have to go somewhere else?
Yeah, I think you understand patient flow maybe better than you think. It's like traffic.
Oh, okay.
So if you got a freeway,
right,
and you got an on-ramp onto that freeway, if the freeway is not moving, the on-ramp backs up and the road before that backs up.
So that means you could be waiting too long to get treatment, and that's not what you want.
Right.
Okay, go ahead.
So the hospital, and the great thing about it at Penn State, the administration gets it, that we're connected. That ED flow is very intimately connected to hospital flow. If we as a hospital are too full or too backed up, it'll affect the flow in the ED. In fact, the flow in the ER it's kind of a barometer for how our hospital is moving.
Yeah.
And they put a lot of institutional work on this. Now with Highmark, they placed some dollars at stake for measures on how we moved patients.
Yeah. Now, what are the demands? I mean, you talked earlier, you said, well, we're going to be careful about what we pay for, but you obviously are worried about readmissions to hospitals. I mean, and sometimes it's not, it's the patient, just as much the patient's problem. He'll tell them what to do and they won't do it right and they'll get readmitted. Right. How are you handling that?
Readmissions are one of the metrics we follow. And we could follow readmissions at 3 days, at 7 days, at 30. And the government really focuses on 30 days. I'm a much bigger fan of that 3-day window because if the patient gets readmitted within 3 days,
then there's something, maybe they shouldn't have been.
Something went wrong.
Yeah, okay, we're going to run to a break. There are a bunch of other questions healthcare costs, what we're doing about it. You're seeing a good example of ways that we can reduce healthcare costs but maintain quality. We're going to pay some bills. They're not going to pay them. We're going to pay them. We'll be back in a minute.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
All right, we're talking about how to reduce healthcare costs, and there's a program called SIDES. I won't even get into the definition of what the acronym stands for, but basically, what's that program and how has that helped?
We set it up with providers in the hospital in combination with folks from Penn State main campus in industrial engineering as well as information technology, the computer guys and the folks that manage systems and process as well. And they think like this. We don't always think like that. And worked hard on our ER. We redesigned the front end of our ER.
So the physical plant you redesigned?
Right. We added about 7,000 square foot of space, but we had a lot to do in terms of changing the way we thought about it. In the past, if you came in, you saw a triage nurse, and if there wasn't a room in the back, you had to go backward into a waiting room for who knows how long.
So you waited, you got admitted technically, and then you waited.
Yeah, the design change is that we eliminated the waiting room at the front end of the ER.
Well, wait. Where do you go?
Well, in general, you go right back to a room. Our door to doctor time, we've reduced it down to around 20-ish minutes.
So let me get this. So you got all the science and technology people together and say, how can we get rid of a waiting room so you go right back to a room and then you see a doctor within, is there a time, like a time?
Well,
10, 15 minutes?
The average is between 20 and 25 minutes.
Really? But that's still not bad, given, 4 o'clock in the morning when you got all these patients coming in, right, have some emergency over a weekend, and you can see how many patients?
Me personally?
No, your facility.
Yeah, we see, we're going to about 70,000 patients a year.
Oh my gosh.
Next year.
Now, people still using, we have these complaints over the years about people going into emergency rooms because they don't have coverage.
Don't have access.
Presumably we'll see what happens with the Affordable Care Act and whether that gets reduced. Is that still a serious problem for cost? Because emergency rooms aren't inexpensive.
It is.
Do you want good quality? Go ahead.
It is, and we have several programs, our medical home programs, that focus on access, more access for the patients.
What's a medical home program?
The medical home program is, actually it's not an insurance term, it's a medical term developed by the pediatricians and family physicians many years ago. And essentially what it is more communication and more management of the patient. It's what I did as a family doctor many years ago, quite honestly, where you manage that patient from front end to through the hospital and back, and you know what's going on with your patient and their laboratory tests. But
so in other words,
that opens access.
Hold on. I think this is important. So what you do is you have one physician that's going through the process so that you don't get, duplicative services, so you make sure that what you ordered gets done properly.
Essentially one physician or one practice managing your care.
Yeah. And is that helpful to you?
In the ER, it is helpful if we have a person to refer back to.
Ah.
Sometimes patients come in without a primary care doctor, but we work hard to try to streamline the connection between the ER and the primary care
This is great stuff. I mean, I think as medicine evolves, you guys know more about than I do. We do a lot of healthcare research, but it's still, the other thing that I like now is being able to get online to check all my records. Like I have an appointment in a couple of weeks to get some blood work done. They've already have the appointment up and the results will be there. You really are making great strides, aren't we, to kind of get the technology involved to help streamline the process. Exactly.
We are. And I think this whole concept of that SIDES program that takes the teachings and the discipline of engineering and brings them to medicine, whether it's in the emergency room or the throughput in an office practice today. Just incredible.
Well, look, I want to thank you for coming on. I think these are really helpful suggestions to the folks, or at least now our viewers get a better handle on the big changes that are taking place. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.